Good afternoon, everyone. I am Ms. Razia, second semester BSc Nursing student of Surgery Institute of Nursing Sciences, Shimoga. Today I am going to demonstrate the urine test for sugar. It is also known as Benedict test. So let's see the definition of urine test for sugar. So it is a diagnostic test used to check the presence of glucose in our urine. If it normally in our urine there is no presence of glucose, if it is present it may indicate there will some abnormal carbohydrate metabolism or any renal dysfunction. So let's see the purpose. First we are going to check the diabetic in certain patients who are having a diabetic symptom. Then we are going to check in pregnant women to know the gestational diabetes, and we are going to check for renal glycosuria. Then let's see the preliminary assessment. In preliminary assessment, we are going to check the doctor's orders. In that, we are going to check the what test we have to perform. Then we are going to check the patient condition. Next, we are going to see the preparation of the patient. We have to explain the procedure to the patient first. Then we have to ask need any help. Then we have to instruct them to collect midstream urine. Let's see the needed article for the procedure. A clean tray contains one pair of gloves to protect our hands and one goggles to protect our eyes. Then we have a spirit lamp to heat the test tube. Then we have a specimen urine. Then a matchbox to light the lamp. Then one towel to wipe the spillage, then test tube to heat the solution and urine. Then we have a 5 ml syringe with the Benedict solution, a test tube stand to collect the material, then test tube holder to hold the test tube, then dropper to add the urine drop by drop. Then here we have the interpretation chart to know the color changes and what it indicates. So let's see the procedure. Before procedure we have to wash our hands. Here I already performed the hand hygiene. I am going to wear the gloves. Then I am going to wear the goggles to protect my eyes. First I am going to open the lid of the spirit lamp, and I am going to place the towel aside to more space, and I am going to open the lid of the specimen. Here I am going to take the test tube and hold with the test tube holder. Then I am going to add the 5 ml of Benedict solution. In placing in the test tube stand, and I am going to heat the Benedict solution over spirit lamp. The test tube mouth should be away from the face. We have to heat till it is boiling. Here the bubbles are appearing, which means it is boiling. Then we have to take and we have to take this dropper, and we have to take some amount of urine. Then we have to add 8 drops of urine in Benedict solution. So here I add the 8 drops of urine, and I am going to keep the dropper in a test tube stand. I am going to scroll the gently to check the color changes. After adding the urine drops, I am going to heat again to check the color change. Now you can see there is no changes in color. So I am going to put in a test tube stand, and I am going to take out the test tube holder, and I am going to place in a test tube stand. I am going to close the lid of the urine container. Here you can see interpretation. So the color is blue, which indicates there is no presence of sugar in urine, and in green you can see there is a presence of glucose, which is 0.5 to 1, but in little bit. In yellow you can see there will be 1 to 1.5 gram of sugar will present in urine. Then in orange there will be moderate presence of glucose, which is 1.5 to 2 gram of glucose in urine. In brick red color, which indicates severity, here more than 2 gram of glucose is present in urine. So after the test, we have to replace the articles, and we have to wash the test tube with soap and water. Then we have to leave it for dry. Then the specimen we should discard in yellow bin. Then we have to check for any spillage is there. We have to clean with the towel. After that we have to remove our gloves and wash the hands. Have to record the what procedure we did and which type of solution we use, and we have to record if any color changes is there. So this is all about the urine sugar test. Thank you.